Hello everyone, welcome to the Lab Informants. This is a platform that helps you to understand about your health conditions and also the role of laboratory in management and diagnosis of your health conditions. Today's presenter is Mr. Eric Masiga, and today we are going to discuss about cancer. In our today's agenda, we will help you understand what is cancer, the difference between cancer and normal cells, what causes cancer, general signs and symptoms of cancer, classification of cancer, staging of cancer, laboratory diagnosis, and mainly the role of laboratory in diagnosis and management of cancer. We'll also help you understand about the management of cancer and as well as the morbidity and mortality rate by cancer. Cancer is a disease in which some body cells lose the ability to follow the normal control that the body exercises or applies to all other cells. Difference between cancer and normal cells. Cancerous cells differs from normal cells in that when you look at normal cells, the normal cells reproduce themselves exactly, they stop reproducing at the right time, they obey signals from the neighboring cells. Normal cells also stick together in the right place and they self-destruct or be sensed by body's immune system and be destroyed. They also become mature or specialized and perform a specific function. Whereas, cancer cells do not reproduce themselves exactly. They do not stop reproducing after they have doubled, and they do not obey signals from neighboring or other cells. Cancer cells also do not stick together, and they do not self-destruct, or cancers they cannot be sensed by the body's immune system and get destroyed. Cancer cells do not become specialized, but stay immature. What causes cancer? Cancer is caused by damage or changes, which are called mutations, to the genetic materials within cells. The genetic material or the DNA inside the cell instructs the cell on what functions to perform as well as how to grow and divide. Errors in these instructions can cause the cell to stop its normal function, and this may allow a cell to divide uncontrollably and grow, developing into a tumor. Cancer can be described as solid tumors or liquid tumors. Solid tumors refers to a solid mass of cancer cells that grow in an organ system and can occur anywhere in the body, while liquid tumors occur in the blood, bone marrow, or lymph nodes. General signs and symptoms of cancer. Quite often, cancer has no specific signs or symptoms, and it is important that people limit their risk factors and undergo appropriate cancer screening. However, these are some of the most common signs and symptoms that may be caused by cancer. Croaky voice, hoarseness or a cough that won't go away, or voice changes may be a sign of laryngeal cancer. Mouth or tongue ulcer that lasts longer than 3 weeks may be a sign of tongue cancer. Coughing up blood may be a sign of lung cancer. Unusual changes to the size, shape, or feel of a breast, including nipple or skin, may be a sign of breast cancer. A change in bowel habits, such as constipation, lose a poo, or pooing more often, and blood in your poo may be a sign of colorectal cancer. Unexplained vaginal bleeding, including after sex, between periods, or after menopause, may be a sign of cervical cancer. Breathlessness or shortness of breath may be a distressing factor of lung cancer. Difficulty in swallowing or problem swallowing, especially a feeling of food stuck in the throat, is the most common symptom of esophageal cancer. Persistent heartburn or indigestion may be a sign of gastric cancer. Loss of appetite and persistent bloating may also be a sign of stomach cancer. Other signs may be heavy night sweats, loss of appetite, fatigue, unexplained weight loss, unexplained pain or ache, unusual lump or swelling anywhere on your body, a new mole or changes to a mole, a sore or a wound that does not heal on any part of the body, especially if you don't have diabetes. It is necessary to note that most of these signs and symptoms are not caused by cancer, but can also be caused by other diseases or conditions. And if you have any of these signs and symptoms that don't go away or get worse, you can consider seeing your doctor to find out what could be causing them. The doctor can help you to figure out what the cause is and also how to treat it if need be. Classification of cancer. Cancers are classified using the site at which the cancer started or the type of tissue where the cancer originated. There are 4 main classifications or types of cancers, and these are carcinomas, lymphomas, leukemias, and sarcomas. Carcinomas are cancers that begins in the skin or tissue that covers the surface of internal organs and glands. Carcinomas are usually solid tumors, and they are the most common type of cancer. Examples of carcinomas are thyroid gland cancer, breast cancer, lung cancer, liver cancer, colon cancer, skin cancer, cancer of the bladder, prostate cancer for male, and cervical cancer for female. Leukemia is a cancer of blood cells and bone marrow, and leukemia begins when the healthy blood cells change and grow uncontrollably. Examples of leukemia include acute lymphocytic leukemia, acute myelogenous leukemia, chronic lymphocytic leukemia, chronic myelogenous leukemia, and also other types of leukemia such as myelodysplastic syndrome and myeloproliferative disorders. A lymphoma is a cancer that begins in the lymphatic system. The lymphatic system is a network of vessels and glands that help the body to fight against the infection. There are two major types of lymphomas, and these are the Hodgkin's lymphoma and non-Hodgkin's lymphoma. Sarcomas include cancer of fat, bone, and muscle. Staging of cancer. Staging refers to the extent of a disease evaluated by non-invasive and invasive diagnostic tests and procedures. In this context, staging is used to define the extent of cancer as localized or as exhibiting spread outside the organ of origin to the regional but not to distant sites, or as metastatic, meaning if the cancer has traveled to distant sites. The information obtained from staging of the cancer aids or helps in determining the appropriate treatment for each patient, evaluating the outcome of these treatments, estimating the chances of survival in individual patient, and also comparing the results of treatment in different cancer centers. The standard system for staging most cancers is based on the tumor, lymph node, and metastasis, mostly abbreviated as TNM. The T in TNM relates to tumor, and it indicates the size of tumor, extent or penetration, that is the depth of the tumor. The N stands for the node. It indicates the number of lymph nodes with the cancer or the location of the cancer involved in the lymph nodes. The M stands for distant metastasis, or spread of the cancer to other parts of the body. There are majorly three methods used in staging cancer, and these are clinical methods, pathological methods, and radiological methods. The clinical methods presupposes examination of the cancer-bearing site for the size of the cancer, the mobility, that is if the cancer is mobile or immobile, and the skin overlying cancer. It also entails examination of draining lymph nodes, whether they are enlarged, mobile, fixed, or mattered together. The pathological staging method gives a more precise information which can be used to help determine what other treatments might be needed, as well as to help predict the treatment response and outcomes, which is prognosis. The use of radiological method or investigations must be suited according to the nature of cancer. Laboratory diagnosis. If cancer is suspected, a doctor may order certain cancer blood tests or other laboratory tests such as analysis of body fluids, sputum, urine analysis, or a biopsy of a suspicious area to help guide the diagnosis. Examples of blood tests that are ordered include a complete blood count, which helps to diagnose blood cancers such as leukemia and lymphoma, and it also helps to find out if the cancer has spread to the bone marrow. Genomic sequencing is a laboratory technique that helps to read the genetic information that is found in the DNA. This type of genetic testing is sometimes done to determine if cancer cells of a person who have already gotten a cancer diagnosis has genetic changes that can be used to guide treatment. Cancer gene mutation testing provides physicians with more data about the causes of cancer and changing the way some forms of the disease are treated. In some cases, if a doctor suspects a cancer like multiple myeloma, he may order a serum protein electrophoresis, Billington's protein in urine, bone marrow biopsy, alongside other tests to help guide in the diagnosis. Even so, tumor markers or substances that are produced by cancer tissues itself or sometimes by the body in response to cancer growth can be detected in body samples such as blood, urine, or tissue, and these markers may be used alongside with other diagnostic testing to help detect and diagnose some types of cancer. There are many different types of tumor markers, some of which are prostate-specific antigen or PSA, which help to detect prostate cancer, carcinoembryonic antigen or CEA test, which helps to diagnose and manage some cancers of the large intestine and rectum, CA19-9 for pancreatic cancer, cancer antigen 15.3 or CA15.3 related to cancer antigen 27.29 are useful tumor markers to follow up in the course of breast cancer. Cytokeratins or CIFRA 21.1 may be useful tumor marker in evaluation of non-small cell lung cancer and cause monitoring in myoinvasive blood cancer. Cancer antigen 72.4 is a tumor marker that has been found to be elevated in a variety of human adenocarcinomas. Calcitonin can be a significant tumor marker for medullary thyroid cancer. Human chorionic gonadotrophin hormone or HCG is also used as a tumor marker for germ cell tumors. A beta-2 microglobulin tumor marker is not used to diagnose any cancer, but it can provide a very important information about the prognosis of patients with multiple myeloma, lymphoma, and leukemia. Circulating tumor cell tests, CTC tests provides much more valuable information that is useful in predicting prognosis and progression-free survival in patients with metastatic breast cancer or MBC, metastatic colorectal cancer or MCRC, and metastatic prostate cancer. Role of laboratory in diagnosis and management of cancer. Laboratory detection of tumor markers helps to confirm a diagnosis early, allowing treatment to begin when the disease is most manageable to therapy. On that account, the information provided from the laboratory by the laboratory specialist is used to make diagnostic decisions. The laboratory detection of tumor markers and also examination of histology and cytology samples by pathologists helps to confirm a diagnosis early enough, allowing treatment to begin when the cancer or disease is most manageable to therapy. Secondly, this information is also used to check for drug efficiency monitoring and determining whether the cancer is responding to treatment. Also, this information is also valuable in determining whether the cancer has recurred or come back. Nonetheless, laboratory investigation in screening for cancer or precancerous conditions before a person has any symptoms can help reduce the rate of mortality or death rates due to some types of cancer. To stage a cancer, laboratory provides information about the size of a cancer, that is, its severity for the malignant tumors, and this includes the size and or extent of the original or primary tumor and whether or not tumor or cancer has spread from the place at which it first arose as primary tumor to a distant location in the body. Laboratories also provide information that helps in planning for cancer treatment, besides monitoring patients' general health during treatment and to check for potential side effects of the treatment. Management of cancer. Cancer treatment is not simple and easy because cancer is a group or a cluster of over 200 different diseases with common characteristics, but they are all different from each other. Furthermore, cancer itself is not homogeneous or similar. There may be various different slight variations in the existing cancer cells. And this explains why, for example, someone who has a breast cancer may not be treated in the same way with another person who also has a breast cancer. The treatment options offered to cancer patients are based on treatment goals for each specific type of cancer. And there are three main types of cancer therapies, which are chemotherapy, surgery, and radiation therapy. Chemotherapy uses drugs to destroy cancer cells. However, the drugs that are used in chemotherapy are powerful and they can also cause damage to healthy cells. Thus, there are side effects that are associated or linked to chemotherapy. Surgery entails the removal of cancer or the tumor and the nearby tissues during an operation by specialist doctors called surgical oncologists. Whereas, radiation therapy or radiotherapy uses X-rays or radiations to kill the cancer cells. At current, cancer is one of the leading causes of death worldwide, accounting for nearly 10 million deaths in 2020. Approximately 70% of these deaths occur in low and middle income countries. By statistics, Kenya definitely has a growing cancer problem with about 47,000 new cases and 33,000 deaths annually. This is a huge number for a country with a population of almost 50 million people.
With a simple health checkup, you know it early, you know it exactly. Taking into account biopassion diagnostics advocacy. An early detection gives you the best chance for getting the right treatment quickly, avoiding any health complications.
Remember, a cancer survived is a life revived.